My name is Jessica Powell, and I will be performing a basic IV insertion today. I'm in FSCJ's nursing program, and I'm in Term 2 in Section 5. So I'm going to look at my doctor's orders, and I see that the doctor has ordered a 20-gauge IV for a blood transfusion. So I'm going to go into the patient's room. I'm going to introduce myself, explain what I'm doing. The doctor has ordered a 20-gauge IV for a blood transfusion. I'm going to ask for allergies, no planned procedures today, and then I'm going to go ahead and prime my tubing. I'm going to take a 10mm syringe. I'm going to perform hand hygiene. Take a 10mm syringe and pull 3 milliliters of normal saline. I'm going to recap my needle. And then that goes in the sharps container. I'm going to take my extension tubing and I'm going to prime it to ensure that there is no air in the tubing. And then I'm going to perform hand hygiene again, and I'm going to take the tourniquet, and I'm going to choose an arm that has no fistulas or shunts, and if it's a female, has no history of a mastectomy on that side, and I'm going to choose the non-dominant arm, and I'm going to choose a site that is not going to interfere with the patient's ADLs. And I'm going to apply the tourniquet 4 to 6 inches above where my insertion would be. After I apply the tourniquet, I'm going to assess for a radial pulse, palpate. I have a radial pulse. I'm going to ask the patient to pump their arm. And then I'm going to palpate for a good bouncy vein. Once I've chosen my vein, I'm going to perform hand hygiene. I'm going to put on gloves. I'm going to clean the area that I want. I'm going to use my alcohol swab to mark the vein that I want. I'm going to get my extension tubing ready, prepare my needle. I'm going to insert the needle with the bevel up at a 15-degree angle. I'm going to pull the skin taut. I'm going to inject until I see a flashback. I have a flashback. I'm going to inject the catheter all the way in. I'm going to release the tourniquet, apply pressure about 1 inch above where the site is, remove the needle, and that goes in the sharps container. Then I'm going to take my extension tubing, attach to the end. I'm going to unclamp it. I'm going to aspirate for a blood return. I'm going to have a blood return, then I'm going to flush using a push-pause method to ensure patency. Then I'm going to, with positive pressure, reclamp my tubing and remove the syringe. I'm going to take my Tegaderm. I'm going to apply it at the base of the hub. And then I'm going to secure the extension tubing with tape. And then I'm going to write my initials, date, time, and the gauge, and place it on the Tegaderm. Then I'm going to remove my gloves, and I'm going to perform hand hygiene and throw away any material that I used and put any needles left out in the sharps container. And I'm going to document the date and the time of insertion, the site, which I chose the left forearm, the size and type of the catheter, the number of attempts required, which took me 1 time, the patient's response to the treatment, as well as any instruction given to the patient.